And this is from the Trivandrum heart failure registry. 55% of the patients had hospitalization, heart failure, heart diabetes, at hospitalization and at discharge. And looking at the other studies across the globe, around 30% of the patients of chronic heart failure has diabetes. And the reverse is in diabetic patients, the prevalence of heart failure is approximately between 10 to 30%. So even in patients of diabetic, the incidence of or prevalence of diabetes is also quite high. What ARNI does is that it improves cardiovascular death or heart failure hospitalization and quality of life, irrespective of the glycemic status. When you look at the overall benefit of hospitalization, heart failure, hospital, cardiovascular death, so there is a 20% risk reduction in a patient who is normal glycemia, a patient who is pre-diabetes, patient with undiagnosed diabetes, and patient with diabetes mellitus. So there is no difference in the efficacy. So p-value for interaction, see the p-value for interaction. So the beneficial effect of ARNI is seen across the different glycemic status. Even there, you see, look at the individual component like cardiovascular death, heart failure, hospitalization, even all-cause mortality, and the improvement in quality of life also, they're all showing beneficial effect across the glycemic status. And interestingly, what it shows that the HbA1c reduction is significant. HbA1c is significantly low in patients who are on sacubital valsartan vis-a-vis enalapril. The subgroup analysis over a period of 3 years consistently found that HbA1c is low in comparison to enalapril, but the p-value for interaction only for this first year and second year. So there is a statistically significant difference. It's not seen in year 3. But it looks like that patients who are receiving sacubital valsartan has a better HbA1c control. New use of insulin was 29% lower with ARNI versus enalapril, and fewer patients were started on OHS therapy with ARNI. So not only it has a lower HbA1c, the chances of insulin is reduced by 29% receiving, and the new onset, even the patient receiving OHS also appears to be less.